everyone, this is Dr. Ashwini. This week I thought I'll speak about skin cancer awareness and what happens during a skin check. Now, it was National Skin Cancer Action Week last week. So I thought this is a good time to just bring awareness around this topic and just answer some curious questions around what happens when you go for a skin check. Now, everyone who's exposed to the sun is definitely encouraged to have a skin check done. This can be done with your regular GP if they're trained in skin cancer checks, or can be done with the dermatologist or specific skin cancer doctors. So find out who's close to you. So what happens during a skin check? First, make sure you're booking a skin check appointment. For females, preferably come with no makeup so we can do a full assessment. So usually the doctor will get some history and understand what are your risk factors, look at the types of skin you're having, and then discuss prevention strategies, and then we'll go into checking your body from head to toe. We usually use an equipment called a dermoscope, which allows us to look into the skin in detail and pick up any abnormalities that we may have to check further. Now, once we find out something abnormal, usually if we can see it and we'll tell you straight away, okay, this is a high risk one, it's possible cancer, let's get it out. And then you'll have to book for an excision. But if sometimes we are not very sure, we will say, okay, let's do a biopsy and see what the results comes. Now, if the results is showing it's cancer or may progress to cancer, and we may also get that lesion out. So after that, the doctor will tell you, okay, let's check it up in a month's time, 3 months, 6, 12 months, based on your risk and the type of diagnosis that you have. But if you've come for a regular skin check and there's no abnormal lesions, there's nothing detected, usually for my low-risk patients, I'll tell them to come back yearly, some 6 monthly. But in the meantime, if they notice any changes or any discoloration, a new mole that they may be concerned about, I definitely ask them to book in and come. Now, so what are the 5 steps that all of us can do to prevent us from the skin cancers and sun damage that can happen? Number 1, slip on protective clothing that cover every skin that's exposed. Slop on SPF 30 and above sunscreen, and preferably use it 20 minutes before you leave your house. And if you're out in the sun, you probably need to reapply every 2 hours. And seek shade where possible. Wear sunglasses and slap on a hat. So these are the 5 S's that's been advised that all of us can do to prevent sun damage. But I'm saying that please get regular skin checks from your health professionals. It's important to understand how to reduce the risk and prevent skin cancers from happening. Teach your children from young what are the steps they can do to prevent sun exposure and sun damage from happening. So with this, I hope it's been educational, and I'll see you next week with another video. See ya.